10 crucial signs your kidneys are crying for help. Did you know that around 14% of US citizens are estimated to have chronic kidney disease? That's millions of people dealing with kidney problems. Our kidneys are quiet warriors. They work around the clock to filter waste, balance fluids, and keep our blood pressure in check. But when they start struggling, the signs are subtle and easy to overlook. In this video, I'll walk you through the 10 major warning signs that your kidneys might be in trouble. I'll explain each sign in simple terms so you may spot them early and take action to protect your health. Stay tuned, because after learning about these signs, I'll also share 5 everyday habits that could be harming your kidneys without you even realizing it. Now, let's start the video. 1. Persistent fatigue and weakness. People with kidney disease often face persistent fatigue and weakness, symptoms that may deeply impact daily life. This fatigue stems from the kidney's essential role in filtering waste and balancing fluids and electrolytes. When kidneys are damaged, they struggle to efficiently filter blood, leading to a buildup of toxins in the bloodstream. This buildup affects multiple organs and body systems, making even simple tasks feel exhausting. Another key reason for fatigue in kidney disease patients is reduced production of erythropoietin, a hormone made by healthy kidneys that signals the body to produce red blood cells. Red blood cells carry oxygen to muscles and organs, but as kidney function declines, less hormone is produced, leading to fewer red blood cells. This condition, known as anemia, means there's less oxygen to support muscles and energy production, leaving people feeling constantly tired and drained. According to PubMed, fatigue is one of the most common and distressing symptoms for kidney disease patients, appearing as early as chronic kidney disease stages 2 to 3. Patients experience significantly more fatigue than healthy individuals, with 20 to 91% affected, and the severity often increases as the disease progresses. 2. Changes in urination pattern, frequency, color, or appearance. One common sign of kidney disease is how often someone needs to urinate. As kidney function declines, people might find themselves urinating more frequently, especially at night, or on the contrary, they might notice a drop in urine output. This may be confusing, as both increased and decreased frequency may be signs of kidney disease. When the kidneys aren't working efficiently, they struggle to regulate urine production, which may lead to either retaining too much fluid or releasing it in irregular amounts. Moreover, foaminess or bubbles in the urine may be another indicator, often signaling the presence of protein. Healthy kidneys typically keep larger molecules like proteins in the blood, but when the kidney's filtering abilities are compromised, protein may leak into the urine, causing it to look foamy or bubbly. This condition, called proteinuria, often suggests kidney damage and requires medical attention. Urine that appears red, pink, red-brown, or orange may sometimes signal kidney issues. Science Direct notes these colors may indicate hematuria, blood in the urine, or the presence of hemoglobin, myoglobin, or medications like warfarin. These substances often appear due to kidney damage, infection, or inflammation, where blood or muscle proteins leak into the urine due to impaired filtration. 3. Swelling in ankles, feet, or hands. The reasons this swelling often appears in these specific areas is due to how the body's circulation works. When fluid isn't removed properly, it tends to pool in the lower extremities, especially when someone is upright throughout the day. This is why people with kidney disease often notice more swelling at the end of the day. The condition may feel uncomfortable, tight, and even painful, impacting mobility and overall comfort. Swelling related to kidney disease isn't just about extra water hanging around in the body. Excess sodium in the bloodstream plays a major role too, as sodium causes the body to retain more water to balance it out. This further exacerbates swelling and makes it harder for the kidneys to regain control of fluid balance. When this continues over time, it creates a cycle of fluid retention that strains both the kidneys and the cardiovascular system. According to studies by Curious, edema or fluid buildup may weaken knee muscles, affecting strength in people with chronic kidney disease. The patients often have fluid imbalances that lead to muscle loss and frailty, which raises their risk of falls. Lower body weakness is especially important to watch, as it may signal future falls and mobility issues. 4. Shortness of breath. One major reason people with kidney disease experience shortness of breath is fluid buildup in the body. When the kidneys aren't working properly, they struggle to remove excess fluid. This extra fluid may accumulate in the lungs, a condition known as pulmonary edema, making it harder for the lungs to expand fully with each breath. People might feel like they can't catch their breath or that their chest is tight and heavy. This sensation may be especially noticeable when lying down. Anemia or a low red blood cell count is another key factor. The kidneys produce a hormone called erythropoietin, which signals the body to make red blood cells. These cells carry oxygen from the lungs to the rest of the body. When the kidneys are damaged, they make less erythropoietin, leading to fewer red blood cells and less oxygen being transported. This lack of oxygen may leave someone feeling winded or short of breath, even with minimal physical activity. Walking up a flight of stairs or carrying groceries might suddenly feel like a major effort, leaving them gasping for air. Journal of Personalized Medicine reports that chronic kidney disease impacts over 800 million people worldwide, particularly affecting low- and middle-income countries. As a leading cause of death, it also disrupts lung health, causing breathing issues and fluid imbalances. 5. Persistent nausea and vomiting. People with kidney disease often struggle with persistent nausea and vomiting, which may become a frustrating and uncomfortable part of daily life. When kidneys are damaged, they lose their ability to filter out toxins, leading to a buildup of waste products in the bloodstream. This buildup of waste, known as uremia, may cause a wide range of symptoms, and nausea is one of the most common. Additionally, this toxin buildup affects the digestive system directly, making it more sensitive and reactive. The stomach lining may become irritated, leading to queasiness that doesn't seem to go away. Some people describe feeling sick shortly after eating or even waking up nauseous. Vomiting may occur when this irritation becomes too intense, as the body attempts to remove what it sees as harmful or out of balance. Uremic toxins also affect the brain's chemistry, contributing to feelings of nausea. When waste builds up in the bloodstream, it may influence the brain's vomit center, triggering queasiness and even the urge to vomit. This may make people feel sick without a direct cause related to food or digestion. They may feel randomly nauseous, especially as their kidney function declines. For many, this becomes a constant source of discomfort, affecting appetite and nutrition. A study on 60 hemodialysis patients at Semnan University found that nausea and vomiting are common during dialysis. About 28% of the patients experienced nausea and 12% had vomiting. 6. Metallic taste in the mouth and ammonia-like breath. The metallic taste is often due to uremia, a condition that occurs when waste products accumulate in the blood because the kidneys aren't filtering them out properly. These waste products, which include urea and other nitrogen-based compounds, circulate throughout the body and may reach the saliva in the mouth. As a result, many people with kidney disease describe a persistent metallic or bitter taste that doesn't go away with brushing or rinsing. An ammonia-like odor on the breath, often called uremic feta, is also tied to the body's struggle to deal with excess waste. Urea, a byproduct of protein breakdown, builds up in the blood when kidney function declines. Normally, the kidneys filter urea out of the body through urine, but when they can't keep up, urea may reach the saliva. Enzymes in the mouth break down urea into ammonia, which has a strong, unpleasant smell that resembles ammonia or urine. An Oxford Journal study of 17 dialysis patients and 29 healthy controls found that dysgeusia, or abnormal taste, is common in chronic kidney disease and may affect nutritional intake. 7. Dry and itchy skin. As kidney disease progresses, it often leads to an imbalance of minerals and nutrients in the body. For instance, when kidneys can't properly filter phosphorus, levels of this mineral increase in the blood. High phosphorus levels cause calcium to be pulled from the bones, which may lead to calcium deposits in the skin. These deposits often lead to a persistent itching sensation called uremic pruritus, which is common in people with advanced kidney disease. This itchiness may be intense and difficult to control, interfering with sleep, concentration, and daily activities. Dryness is another major factor. The kidneys help control fluid balance in the body, and when they're not functioning well, the skin often loses moisture. This results in dry, rough patches that make the skin feel tight and uncomfortable. Over time, this dryness may exacerbate the itchiness, creating a cycle of discomfort that may be hard to break. Without sufficient moisture, the skin becomes more fragile and may appear flaky, adding to the feeling of constant irritation. Hormonal changes due to kidney disease also impact skin health. For example, vitamin D is activated in the kidneys, and when kidney function is impaired, vitamin D activation declines. Vitamin D is essential for skin cell repair and immune function, so low levels may make the skin more prone to dryness and irritation. Additionally, poor vitamin D levels affect bone health, which ties back into the mineral imbalances that contribute to itching. The National Library of Medicine explains that uremic pruritus, or kidney-related itching, is a common and uncomfortable symptom for people with chronic kidney disease and end-stage kidney disease. This type of itching happens daily or nearly every day without any specific skin condition and affects over 40% of dialysis patients. 8. High blood pressure. When the kidneys are damaged and their filtering abilities decline, they struggle to remove excess fluids and sodium from the body. This excess fluid increases blood volume, which means there's more pressure on the blood vessels. This increased volume and pressure lead to high blood pressure or hypertension. For people with kidney disease, this pressure may be constantly elevated, adding extra strain to the heart and blood vessels. Beyond fluid retention, damaged kidneys produce renin in irregular amounts, which interferes with the body's ability to control blood vessel constriction. When blood vessels are too constricted, blood pressure rises. For people with kidney disease, this misregulation of renin means blood pressure may stay high, even when the body doesn't need it to. High blood pressure, in turn, may cause additional harm to the kidneys by damaging the tiny blood vessels that filter blood within the kidneys. This damage reduces kidney function further, creating a cycle where the kidneys are progressively harmed and blood pressure continues to rise. According to the National Institutes of Health, high blood pressure may tighten and narrow blood vessels, which over time weaken and damage them throughout the body, including in the kidneys. This narrowing restricts blood flow, affecting kidney function and overall health. 9. Frequent muscle cramps. One of the primary reasons for muscle cramps in people with kidney disease is an imbalance of calcium and phosphorus. The kidneys help control levels of these minerals, which are essential for muscle contraction and relaxation. When kidney function decreases, calcium levels may drop, while phosphorus levels may rise. Low calcium levels affect the way nerves signal muscles, leading to involuntary contractions, which we experience as cramps. In advanced kidney disease, this imbalance may become more pronounced, causing cramps that may feel sharp and last for several minutes, often impacting sleep and comfort. Another key factor is potassium levels. Potassium is a critical electrolyte that helps with muscle function, and it's also regulated by the kidneys. When the kidneys can't filter out excess potassium, levels may fluctuate too high or too low. Either extreme may lead to muscle cramping, as potassium directly impacts how muscles respond to signals from nerves. High potassium may make muscles overly excitable, leading to twitching or cramping, while low potassium may weaken muscle response, causing discomfort and spasms. These fluctuations are common in kidney disease, especially when dietary restrictions make it challenging to balance potassium intake. Chronic kidney disease is often accompanied by chronic musculoskeletal pain, as shown in a PubMed study of 1,169 patients, where 38% experienced this symptom. Such pain is more prevalent in women and is frequently associated with other chronic kidney disease-related symptoms like muscle weakness, itching, muscle cramps, bruising, insomnia, fluid retention, and shortness of breath. 10. Poor appetite and unintentional weight loss. The physical effects of kidney disease also cause fatigue, and when combined with nausea, they make eating feel like a chore. Many people report feeling full quickly or experiencing a loss of interest in food. This lack of appetite means they're not getting the calories and nutrients they need, leading to unintentional weight loss. Without enough protein, calories, and other essential nutrients, muscle mass may decrease, which further weakens the body and increases feelings of fatigue. Over time, this loss of muscle may make simple tasks more tiring and lead to a decrease in overall strength and physical ability. The mental impact of kidney disease also affects eating habits. Living with a chronic illness like kidney disease is mentally exhausting and may lead to feelings of stress, anxiety, or even depression. These emotional factors naturally decrease appetite, as it may be hard to enjoy food when dealing with the weight of a chronic condition. The emotional toll adds to the physical discomfort, creating a cycle where poor appetite and weight loss reinforce each other. A nutrient study found that appetite loss, which leads to poor nutrition, is common in chronic kidney disease patients but not fully understood. Among 78 patients with reduced kidney function, 42% had appetite impairment. Now, let's discuss 5 daily habits that harm your kidneys. It's easy to overlook kidney health in our daily lives, but certain habits may slowly wear down these vital organs without us even realizing it. I want to share 5 common habits that may be putting your kidneys at risk. Some of these might surprise you, but with a few adjustments, you may give your kidneys the support they need to keep doing their job well. Let's dive in. 1. Not drinking enough water. Dehydration puts extra strain on your kidneys because they need enough water to filter waste effectively. When you're not drinking enough, waste may build up, potentially leading to kidney stones and other issues over time. Aim for steady hydration throughout the day to keep things flowing smoothly. 2. Eating too much salt. High salt intake makes your kidneys work harder to filter out excess sodium. Over time, this may lead to high blood pressure, which is a major cause of kidney damage. Try to be mindful of processed foods and seasoning habits. Small changes may help lower your daily salt intake. 3. Overusing painkillers. Many over-the-counter painkillers, like ibuprofen and aspirin, may harm your kidneys if used frequently or in high doses. These medications reduce blood flow to the kidneys, which may cause damage over time. Consider alternatives and talk with a healthcare provider about safer options for pain relief if you're taking these regularly. 4. Consuming too much sugar. Diets high in sugar may lead to obesity and increase your risk of diabetes, 2 major contributors to kidney disease. Excess sugar also strains the kidneys by causing spikes in blood glucose, which may damage kidney tissue. Keep an eye on sugary snacks and drinks to help protect your kidney health. 5. Ignoring high blood pressure and diabetes. If you have high blood pressure or diabetes, managing these conditions is crucial for kidney health. Uncontrolled blood pressure and blood sugar may directly harm the kidneys over time. Regular checkups, a balanced diet, and taking prescribed medications may help prevent serious damage to these vital organs. Now that you know the 10 key signs of potential kidney trouble, you're already a step ahead in protecting your health. Our kidneys work tirelessly, and by staying informed, you may help them continue to do their job without any setbacks. Remember, noticing these signs early and taking action may make a huge difference. If you've spotted any of these warning signs in yourself or a loved one, don't wait. Reach out to a healthcare professional to get checked. A simple test may give you peace of mind or help you catch an issue before it becomes serious. Now that we have discussed the many signs your kidneys are failing, there are always other signs of health we should look out for. Interested in learning more? Watch 10 warning signs of prostate cancer. Or watch 12 warning signs of pancreatic cancer. Watch one, or even better, watch both. Do you know any other signs of kidney disease? Let us know in the comments below.